Okay, so today we're going to do a deep dive into something pretty major happening right now in the world of public health. President Trump has nominated Susan Monarez to be the permanent director of the CDC.
The Centers for Disease Control and Prevention, yeah, a huge role. And we've got some pretty interesting sources to unpack here.
For sure, and we're talking like really fresh information here. We've got a news report straight from March 24th, 2025,
Yeah.
like hot off the press, and then an analytical briefing that followed it up the very next day on March 25th, 2025.
So we're really working with like up to the minute insights here, trying to get a handle on this situation as it unfolds.
Right, and for anyone listening, why are we focusing on this? Why is it such a big deal? Well, we're going to break down why this nomination is so significant, what President Trump's thinking might be behind it, and what this could all mean for the future of the CDC and, by extension, public health as a whole.
Yeah, and I think one of the things that jumps out right away is the historical context. If Dr. Monarez is confirmed, she would be the first non-physician to head the CDC in over 50 years.
Oh,
That's a pretty significant departure from the norm.
Okay, so let's break it down. Let's start with the nomination itself. Susan Monarez, she's been serving as the acting director, and now she's the president's official pick for the permanent position, right?
Exactly. And I think it's important to remember that this actually comes after the president's initial choice for the role kind of went sideways.
Oh, right. There was that whole thing with Dr. Dave Weldon withdrawing his nomination.
Yeah, it happened right before his confirmation hearing was supposed to take place. And apparently there was some serious pushback from Republican Senate aides. They just weren't happy with his vision for the agency.
And I remember reading that Dr. Weldon was pretty vocal about blaming Senators Collins and Cassidy for, turning against him.
Yeah, he definitely didn't hold back. It was a messy situation all around.
And Dr. Monarez stepped in as acting director fairly recently, right? I mean, after all that went down.
That's right. She took over in January of 2025, right after President Trump's inauguration.
Okay, so she hasn't been in the role for that long, but before that, she was the deputy director at that new federal biomedical research agency, the one set up during the Biden administration.
Yeah, so she's not exactly a newcomer to this whole world of federal health agencies. She's got some experience under her belt.
Right, so she's got the experience, but what is President Trump saying about why he chose her? I mean, what's the reasoning here? What's he hoping to achieve at this nomination?
Well, going by what he said publicly on Truth Social, President Trump's made it pretty clear that he has some serious concerns about the direction of the CDC. He's talked about political bias and disastrous mismanagement as the reasons behind his, lack of confidence in the agency.
So some pretty strong words there.
mm.
Pretty damning, actually. What does he see as Dr. Monarez's role in fixing those problems?
Well, he said that he wants her to work really closely with Health Secretary Robert F. Kennedy Jr. to tackle what he calls the chronic disease epidemic and to restore the agency's accountability.
Interesting. I mean, that suggests a possible shift in focus for the CDC, right? Maybe more emphasis on these long-term health challenges that we're facing as a nation, rather than just, focusing solely on infectious disease preparedness like they have in the past.
It's definitely a possibility, something to watch closely, and it sounds like the president's putting a lot of faith in Dr. Monarez's ability to deliver on this.
Yeah, for sure. He's called her an incredible mother and dedicated public servant. And he said that he believes she understands the importance of protecting our children, our communities, and our future.
So yeah, a very personal endorsement there.
So we've got the president's take on things, but obviously this nomination isn't happening in a vacuum. I mean,
Yeah.
what are other people saying about it, particularly folks in the public health community?
Well, it's interesting you're getting a real mix of reactions. Some experts are actually viewing this as a potential step in the right direction, especially compared to that whole debacle with the previous nominee, Dr. Weldon.
Could you give us an example of who is saying that?
Sure, Dr. Georges Benjamin, the head of the American Public Health Association, he was quoted saying that he sees Dr. Monarez as an improvement over Dr. Weldon. He specifically pointed to her strong reputation as a solid researcher and expert in infectious diseases, and her understanding of how government public health works.
So he seems to think that she might be someone that the public health community can actually work with.
Yeah, that's the sense I get, and it's kind of interesting to think about that perspective alongside some of the concerns that we're hearing from within the CDC itself.
Right, because it's not all sunshine and roses. It sounds like some of the CDC employees are a little uneasy about this nomination.
Yeah, there's definitely some apprehension going around among some CDC staff, and, understandably so. It's a time of change and uncertainty.
What are they saying specifically? I mean, what are their concerns?
Well, according to some anonymous sources within the CDC, there's a real lack of communication coming from Dr. Monarez, particularly in light of what they're calling, a period of tumult.
So people are feeling a bit left in the dark.
Exactly. And to add to that, they've also pointed out that the comment section on the agency's internal website, the place where staff could raise questions and have discussions, well, that was shut down pretty quickly after people started, voicing concerns and asking for more transparency.
Hmm. Not exactly a move that inspires confidence or openness.
Not really, no. And it seems like there's a sense that some of the key players within the CDC, the center directors who are leading all this important research and public health initiatives, well, they feel like they've been left to interpret these new executive orders and court instructions with very little input or guidance from the acting director.
So it's like a top-down approach, not a lot of collaboration happening.
That's the impression I'm getting, and some folks are saying that Dr. Monarez's office is basically acting as a messenger for directives coming straight from the White House and the Department of Health and Human Services.
So not a lot of room for dissent or alternative perspectives.
Potentially not. And, these concerns about a lack of communication and this top-down management style, I think that gives us some hints about Dr. Monarez's leadership style and her priorities.
And speaking of her priorities, we should talk about some of the actions she's taken since stepping into the acting director role.
Absolutely, because actions speak louder than words.
Yeah, exactly. So what has she actually been doing since she took over?
Well, one pretty significant thing is that, according to a former official, she's been working with the Department of Governmental Efficiency, DOGE, on some plans for possible agency reductions. So, thinking about streamlining things and maybe even cutting some programs.
So potentially budget cuts. That's definitely something that would make people nervous.
Yeah, I mean, especially in a time when public health is facing so many challenges.
And then there was that whole controversy about the content on the CDC website.
Right, the removal of certain terms like LGBTQ and transgender.
Yeah, that seems like a pretty big deal for a public health organization. I mean, so much of their work relies on clear communication and, using language that reflects the communities they serve.
Exactly. And according to those anonymous sources within the CDC, Dr. Monarez didn't really push back when the Trump administration issued the order to remove those terms from the website.
And even more concerning, they're saying that no one even tried to save the data from those pages that were taken down.
Yeah, so it's like that information just vanished, poof,
Yeah.
gone.
So we're seeing a pattern here of potential budget cuts, a shift in priorities, and maybe a tendency to align with the administration's directives, even if those directives, cause some controversy.
Right, it definitely raises some questions about her approach to leadership and where her priorities lie.
Now, I want to jump over to something else that was in the briefing document, a sidebar about the Trump administration's first 100 days.
Oh yeah, that gives us some really interesting context for everything we're talking about.
What did you take away from that?
Well, it really highlights just how much influence Elon Musk's DOGE initiative has across different parts of the government. Like, they're talking about changes to the VA's mental health system, interventions in legal firms, even a showdown at the Institute of Peace. It's pretty wild.
So basically, the Trump administration is making some big moves all over the place.
Yeah, it seems like they're not shying away from shaking things up.
So the CDC nomination, it's not an isolated event. It's part of a much bigger picture, a broader trend of this administration really reshaping how the government functions.
Exactly, and it's happening really fast.
Okay, so let's bring it all together here for our listeners. We've done this deep dive into President Trump's nomination of Susan Monarez to head the CDC, and if she's confirmed, she'll be the first non-physician to lead the agency in over 50 years. That's a big deal.
Huge, and we've heard President Trump's reasoning for this nomination, his lack of confidence in the CDC, his desire to see a greater focus on chronic disease, and his personal belief in Dr. Monarez's abilities.
And we've also seen a real range of reactions to this news. Some experts are cautiously optimistic about her potential, but within the CDC itself, there are these serious concerns about a lack of transparency, a top-down management style, and what some see as a willingness to prioritize, aligning with the administration over other considerations.
Right, and her actions as acting director, those budget discussions with DOGE, the website controversy, all of that adds another layer to this whole picture.
Exactly. So as you think about this nomination, think about what it means to have this focus on restoring accountability at the CDC, what it means to have a non-physician in charge, and what it means for the agency to potentially shift its priorities towards this so-called chronic disease epidemic.
There are so many factors at play here, and it's going to be really interesting to see how this all unfolds.
Yeah, for sure. I mean, what are the long-term consequences of all of this? What does it mean for the future public health in this country when you have this kind of change happening at the top of such a crucial institution? That's the question we're left with.
A big
A
one.
big one for sure.